Many factors combine together to affect the health of individuals and communities. Whether people are healthy or not is determined by their circumstances. According to the World Health Organization's Health Impact Assessment, the determinants of health fall into three broad categories: the social and economic environment, the physical environment, and a person's individual characteristics and behaviours. Many factors that are determinants of a person's health are controlled by the government, such as education. Low education levels are linked with poor health, more stress, and lower self-confidence. Health services are also controlled by the government. Access and use of services that prevent and treat diseases influence the health of individuals and communities. What is governance? Governance is the exercise of political, economic, and administrative authority to manage a nation's affairs. Good governance is characterised by consensus orientation, accountability, transparency, responsiveness, equity, effective and efficient, follows the rules of the law, and also strategic vision. Now we're going to look at a few different countries to see examples of how good governance is a determinant of health.
Here in Ireland, we are a nation proud of our government and the advancements it continues to make in the interest of public health. In 2018 alone, we've seen many measures taken by the government to improve the health and well-being of the country. These measures displayed aspects of good governance such as responsiveness by responding to current health crises in the country such as obesity, and strategic vision by formulating and implementing a plan of action to tackle this huge problem. An example of this is the recent taxation on sugary drinks in Ireland.
Up to a quarter of all Irish children are obese or overweight. Doctors say sugary foods and drinks are largely to blame for what they call an obesity epidemic.
As of the 1st of May 2018, the sugar sweetened drinks tax saw 30 cents per litre added on to sweetened drinks with over 8 grams of sugar per 100 millilitres, while soft drinks with 5 to 8 grams of sugar per 100 millilitres are now subject to a tax of 20 cents per litre. The tax is aimed at tackling the obesity epidemic in Ireland. It does so firstly by imposing a financial barrier on sugar-sweetened drinks and therefore lowering their consumption, and secondly by encouraging the industry to reduce the added sugar content of their products. The head of the Irish Heart Foundation says the tax demonstrates a significant commitment on the part of the government to meet its duty of care to protect children in particular from this mortal threat to their health. This tax makes us proud as it shows the enthusiasm of bureaucrats to perform in the interest of public health.
In Southeast Asia, we have very strict laws against drug usage and trafficking. For example, in Malaysia, it is governed by the Dangerous Drug Act 1952 that regulates import, export, manufacture, sale and use of opium, dangerous drugs and related materials. Capital punishment, also known as death penalty, is the highest punishment for the offence. Those in possession of stated weight of drugs will receive mandatory death sentence by hanging. Punishment for lighter offences can range from imprisonment, rehabilitation to fines. The punishment does not only apply to Malaysian citizens. Anyone regarding their nationalities can be caught and punished if convicted. The only resort for the convicted is to plead pardon for clemency from Yang Di Pechuan, Agong, the king. This strict drug laws help control the use of drugs and lower the prevalence of drug-related deaths in the country.
Now to Africa, where the aspects of good governance we will be talking about are transparency and accountability. Take for example Nigeria. The decentralised nature of the federal system should mean the local government ensures public service delivery. However, local government representatives have limited engagement with their communities and many are only present during elections. There is a lack of transparency in their budgetary allocations and often no one is held accountable. This makes corruption a significant problem that impacts many determinants of health.
Out of 100 points, signaling maximum transparency and no corruption, Nigeria scored 27. As the rest of the world has improved in the perception on corruption, Nigeria slips further down as the fight against corruption stagnates.
The health system itself is lacking full capacity and governance, with this reflecting in health workforce crisis.
In terms of manpower, we are far below. We have taken care of 170 million people of Nigeria, about 40,000 doctors, far below the WHO standard.
As we all know, education is a hugely important social determinant of health. It results in better informed health-related decisions, safer employment opportunities, and higher self-esteem.
The 2014 federal education budget was $2.4 billion. Mohammed accuses the government of pocketing money that's supposed to educate children.
Is there not money coming to these schools?
It's corruption from our leaders.
Equity is a key aspect of good governance according to the UN. But how equitable is the United States? Let's find out. Texas. States could be seen as a flagship for capitalism, which basically allows for the private ownership of the distribution of wealth and many important public services. This can result in a wide wealth gap, as can be seen here in Texas, where the Gini index of income inequality is super high at 0.4. The downstream effects of relative poverty are an important social determinant of health, leading to long-term health consequences, including obesity, for which the States ranks 10th in the world. The government also has limited involvement in the healthcare sector. The US does have public health insurance in place for the most vulnerable. This is called Medicaid. But it is the only wealthy nation that does not have a universal healthcare system. Access to healthcare in the US then depends on your socioeconomic status as a result of privatisation of healthcare and healthcare insurance.